am Pastor Mark Barrett, co-pastor at this church, Central Presbyterian. One of the joys of living in this neighborhood, Old Louisville and downtown, is walking along 4th Street with my dog. When I walk the dog, I am very pleased to see the compassion and care that is shown in this neighborhood. If somebody falls or has any kind of problem while they're walking, people stop and help. Even the dogs stop and help. So we are people of care and compassion, and that's something that all of our faith groups have at our core, is compassion and love of our neighbor. That's why we're celebrating the birthday of the Affordable Care Act today, because the Affordable Care Act's middle name is care, and we want to show care for one another. Why do we celebrate the Affordable Care Act? Well, according to the American Medical Association, here are some facts about how the Affordable Care Act helped citizens in Arkansas and Kentucky. After the Affordable Care Act, we saw a 35% increase in the share who got a checkup over the last year, a 39% increase in the share reporting excellent health, and at the same time, a 30% decrease in those skipping medications due to cost, a 33% decrease in those having trouble paying medical bills, and a 64% decrease in the share of those using the ER as their usual source of care. Our president made a campaign promise to provide every American with health care. We are all for that. We want every American to have health care, and health care that's affordable and comprehensive. Health care that includes prevention, reproductive health, and substance abuse treatment. Many selfish attitudes abound in our political life today, but I believe we are better than that. Many of us call for care and compassion in all decision-making in our nation, especially those decisions about health care. Let's care for our neighbor.
Hi, my name is Lisa Kolb, and I am a member of this congregation. And I was just asked to speak a little bit about my story. About 2.5 years ago, I found myself without a job and obviously no health insurance. So I decided to switch careers. I am self-employed. I also have a part-time job, but I'm not offered health insurance. Obviously, but I can't offer myself health insurance, and part-time jobs rarely give you health insurance. So I, through the grace of God, have been a beneficiary of the Affordable Care Act. I don't know what I would do without it. I do have a chronic medical condition, although it's not serious. I do need to see a doctor every 3 or 4 months and have blood work every month. And I would not be able to pay for that myself. As far as the HCA, which is the new Affordable Health Care Act, the new bill, will benefit predominantly young folks who don't really need insurance, who don't have a lot of medical conditions. The potential effects of this bill on certain segments of the population are clear. For the millions of Americans with multiple or with chronic illnesses and conditions, and for nearly the 100 million Americans that make $40,000 or less a year, might be able to get health care coverage under this new act, but it will be more expensive as far as premiums, and it will be less coverage. One group that may benefit from this, again, are the young folks that don't need insurance. Other people that are going to be affected negatively are those who are lower income individuals, older adults, people living in rural areas, and people who gained Medicaid coverage under the ACA. And it's unlikely that the new Health Care Act is anything but a bad deal. And this information comes from Megan Foster Friedman, who is a health policy analyst at the University of Michigan. Thank you.
Hello, my name is Kay Tillow, and I live here in Louisville. I'm with the Nurses Professional Organization. We must not repeal the Affordable Care Act, the ACA, for it has done a lot of good and brought 20 million additional people. And it has opened the doors for many more, and we must not go backwards. And until we can make it better, we must not make it worse. So we should oppose the currently being discussed plan to change the healthcare reform. I'd like to add some additional perspective to the situation in our country. We are the wealthiest nation in the world, with the ability to have the best healthcare system in the world, but we don't. We pay $10,000 per capita. That's what it costs, our healthcare system, and that is double what the other industrialized countries pay. They average about $5,000 per capita. Now, we would say that if indeed we got double good care, we might decide that that is worth it. But the sad story is that we're paying more and we're getting less. We are not getting our money's worth, and our outcomes are better. And the sad tale is that the United States is 29th in life expectancy. That's below Costa Rica, Chile, and Slovenia. The Italians live 4 years longer than we do. They have universal health care. We're not taking good care of our newborns either. We're 33rd in infant mortality. In maternal mortality, we are worse than Iran, Turkey, and Croatia, and many other countries. In fact, a woman giving birth in the United States is more likely to die in childbirth than a woman in any other industrialized country. So what we have done is not yet good enough, and we have to go to work on this. We still have uninsured, I think approximately 30 million in our country, even with the ACA. And tragically, each million people uninsured results in 1,000 deaths annually. So at that rate, we are losing 30,000 people needlessly every year. And if we go to the newly proposed plan, which would add 24 million more, we would be over 50,000 a year that we would lose. Lives that we could save if we had a health care system that included them. And we're still not even doing well with those who are insured, because the coverage for so many of our people has gotten so costly, and the deductibles are high and the copays are high. So even though more are covered, it is not solved, and people who don't have a lot of money cannot afford their care. So we have to do something, and I have a proposal. Marcia Angel, who is the past editor of the New England Journal of Medicine, has told us that we have an enigma in this country, that we have a market-based healthcare system. And with such a system, if you want to improve the care, you have to pay more money. And if we want to cut the costs, we also cut the care. That's the way it works in a market-based system. But she says there's a solution. If we would go to a national single-payer health insurance system and improve Medicare for all, publicly funding our health care and including everyone, we could rein in the costs and at the same time improve care for all of the people and cover all those that are uninsured. So it's the way to go. We have to put the real solution that is right economically and morally onto the table, and the nation deserves to have that kind of a plan. It has been introduced as a bill. It's H.R. 676, sponsored by Congressman John Conyers. It now has 69 co-sponsors, and if the people rise up to demand it, we can make it so.
Good morning. I'm John Crum. I'm a family physician and member of Central Presbyterian Church. some of the accomplishments of the Affordable Care Act. The uninsured rate in the U.S. has declined by 43%. There's been improvement in access to care and financial security in terms of people having to face collections and such for medical bills. Insurance practices have been reformed with essential benefits that include preventive care, coverage of persons with pre-existing conditions, and a requirement that health insurers spend at least 80% of their premiums on health care. Health of patients has been improved, and there are transformations underway of how health care payment systems work, so that we can be moving toward paying for quality and health care rather than paying for piecework and how much treatment we can inflict on people. Kentucky joined 30 other states in adopting Medicaid expansion, doubling its enrollment, and today almost a third of Kentuckians are enrolled in Medicaid. The expansion in Kentucky has led to one of the sharpest drops in the uninsured rates in the country, from 20% to 7.5%. Kentucky's Medicaid expansion has been shown to improve outpatient utilization and preventive care, health care quality, reduce emergency department use, and improve self-reported health. Insurance coverage matters. Multiple studies have shown that insured persons have better health outcomes. A 2008 scholarly review of literature found that health insurance had substantial effects on the use of physician services, preventive services, self-reported health status, and mortality. And I'd like to just repeat that last part. Health insurance reduces deaths. We hear endless criticism of the Affordable Care Act from politicians. My family and I have insurance with Anthem through the exchange established by the Affordable Care Act. Here's our experience. We see the providers that we want, the premiums are competitive, claims payment and insurance procedures are fine, we have no cost for preventive care, and most important to me, our 2 adult daughters with pre-existing conditions were able to start small businesses as self-employed persons and have health insurance. Now our country faces a proposal to replace the Affordable Care Act with the prospect of increasing the uninsured by 24 million by 2026. Health provider groups that oppose the current Republican proposal include the American Medical Association, the American Hospital Association, and the American College of Physicians. This last group, which represents internal medicine physicians, states, quote, "The American Health Care Act would go in the wrong direction, eroding coverage and essential consumer protections for the most vulnerable patients, those who are older, sicker, and poorer." So this physician and consumer hopes we can retain and strengthen the Affordable Care Act. Happy birthday, ACA.
We have one last person who I would like to help lead me in the closing, and that is Tom Moffat, who has worked for Health Care for All Citizens and other peace and justice. Come on up, Tom. You want to say just a word?
Yes, I'd be glad to. I understand this is the 7th birthday of the ACA. It's helped a few people, but most of the people of America are still struggling, and they really don't see much hope on the horizon because the costs are continuing to go up and the care is continuing to be restricted. I'm tired of this. It's time to get down to business and get health care for all, Medicare for all, single-payer health care, H.R. 676. I wish it was on the front of this shirt. There's a bill in Congress, H.R. 676. It's got 70 sponsors. What it needs is 70 million Americans saying we're tired of this foolishness. It's time for health care. Paid for by one payer, Still, you go to the same doctor that you want to go to, any doctor, any hospital, the same kind of good care that we get now that the insurance companies won't pay for. So, it's up to you and me. Our congressperson is in favor, but there are 5 other congresspeople in Kentucky that don't have the sense they were born with. And they need to hear from their constituents. So if you have a friend somewhere else in Kentucky, tell them to beat on their door. That's all I got to say.
Thank you, Tom. Thank you, everybody, for being here. And we want to say happy birthday